Morning, everybody. Everybody else is muted, so, you know.
Morning, Don.
Morning, how you doing?
No, not too bad. I might have to cut out. I'm at work and I got some problems here. I got somebody coming at 9 o'clock, supposedly.
Okay,
I might sign out at 9.
not a problem.
Morning, Don. Can you see me?
Yes?
Hey,
Okay,
how you doing?
good. I've been having a problem getting in on Zoom meetings, and I'm not sure what it is, but
Oh, you're
anyway,
on. You're here, yeah.
yeah.
Yeah, did Rick tell you he was having a problem with his cell phone? He texted me I think it's probably the mathematic equation for time travel.
Oh,
It was it looked like something that was on on some sort of professor's board, and like I said, I guess you must have butt dialed me. So he said he's had some issues with his phone. He's has to take it in. So he said
he did say something about having a problem where it was making all kinds of phone calls on him.
Yep. I didn't get the call. I just got the text.
Oh.
And I looked at it like, okay. So.
So what do I do so that I can see all the participants? Because all I see is you, Don.
There's a up on top. There should be an arrow, a blue circle and an arrow in there, and you can slide it back and forth. I don't know if you can. I think there's some way to make them go on the side too, but I can't. I don't know how to do that.
Yeah, mine are on the bottom.
You're on the bottom. Oh,
Yeah, everybody who's on is on the bottom of my screen.
oh, mine goes across the top, and it shows 10, but
Oh, here it is. I see it.
10 pictures.
Switch to gallery view. Is that it?
Oh, probably. That sounds right.
There we go. Okay,
Okay.
much better.
Is Kirsten here yet?
And then do you want us to be muted until we talk?
If there's no noise in the background, you can stay. If we start getting feedback, then we might have to do that, but usually you can stay on. Okay, let's get Kirsten, are you here? Anybody from the health department here? Okay. Well, we can get going with some of the preliminary stuff anyhow. Let's call the meeting to order of Joint Washington Ozaki Board of Health. I'll do the affidavit of posting. This agenda was posted in the office of the county clerk on the 12th day of January 2021. Notice was sent to the West Bend Daily News, WIBD, WNBC Radio, WTKM Radio, the Express News, My Community Now, the Hartford Times Press, the Kewaskum Statesman, and the Milwaukee Journal Sentinel. We do have a quorum. We'll begin with consideration of the minutes of November 20th, 2020.
I'll move to approve the minutes of November 21st, 2020.
John,
I'll second.
I have I have a correction to it.
Okay,
It was listed as TB was reported to us. It was a question I asked. And there's actually two different sections. One is TB and one is LTBA. And I think we should, because Kirsten said she was going to explain what LTBA meant. They're two different things. It wasn't TB that was reported higher. It was LTBA.
LCBA.
LTBA.
LTB. Okay.
Yeah.
Okay, we'll see if we get, when she gets on, if we can get her to explain that. So,
Yeah. Other than that correction, that's all that I have.
okay, then you second it then with that correction?
I will second it with that correction.
Okay, all in favor, signify by saying aye.
Aye.
Aye. Any opposed? Okay, we accepted the minutes. Anybody from the health department here yet? Okay, I guess we will wait on the other stuff.
We could welcome our newest member, Doug McManus.
Oh, we can do that.
Yeah,
Welcome, Doug.
welcome, Doug.
Thank you. It's great to be here.
Awesome. Any questions before we get rolling?
I think I'll just listen and keep my mouth shut.
I don't know, Doug, can you do that?
Yeah,
Well, we'll see.
you may find something that you wanna opine upon. So,
So
Okay,
tell
well-
us a little bit about yourself, Doug.
Well, I'm a retired physician. I was an internal medicine physician in Port Washington for many years, and then did 10 or 12 years as an administrative physician with Advocate Aurora. I was the chief medical officer for the Greater Milwaukee North and also for the central region of Advocate Aurora before I retired.
very good.
Doug and I got to know each other when we were on the board for the Stars and Stripes Honor Flights. So we went on many flights together.
Oh, wow. Awesome.
So
That's a
we had
good thing to do.
Well, welcome aboard.
Thank you.
Still waiting on the health department? Let's see here. Yeah, I don't see them on yet.
There she is.
And I just got a flash across my screen. My internet connection is unstable. I wonder what that's going to do.
Oh,
I thought just I was unstable, but now my internet connection is
Health
too.
department's having some IT issues, so we're gonna just relocate and we'll have them join you. All right?
Okay.
hey,
Thank you.
Okay. I actually see you fine and can hear you, Jason, from where you're at. So,
He's gone.
okay.
As long as we're waiting, maybe the rest of you could introduce yourselves to me.
Sure. I can start. I'm Don Creefa. I'm the Washington County Board Chairman. And by default, I'm Chairman of the Board of Health. Been on the Board of Health for, 4 years, I think. Chris, you go next.
Hi, good morning. I'm Chris Dice. I'm the Washington County Board Supervisor for District 1, and I'm also the second vice chair of the county board. So I'm here to back up Don because he gets in trouble once in a while. So I try and keep him out of that.
I'm Lois Krieger Gundrum. I represent District 16, which is basically the village of Slinger. I do not have a medical background. My background is in accounting. And this is my first year on the county board.
Okay,
Nice to meet you.
nice to meet you.
Anybody else want to pipe up?
I'm Kathy Geraci. I'm Ozaukee County Supervisor for part of Cedarburg and Grafton. And I have been on this committee for 2 years, and I'm chairing the Health and Human Services Committee for Ozaukee County.
I do that as well.
And
Hi, Doug.
I'm also on the Human Services Committee.
Hi, Doug.
Sorry.
Don Clark, Supervisor for the Village of Saukville on the Ozaukee County Board. And also been on this board for 3 years and serve as Vice Chair of Health and Human Services with Ozaukee County.
Okay,
During Bunchuck, you can't see me. I'm having problems today, but I'm here. I've been on this board since, I think, 1998. I'm from Hereford.
And Doreen, did you just get a recent
Oh, there I am.
appointment? There you are.
Yes.
Just get a recent appointment to the
Yeah.
Chamber of Commerce?
Went back to being the executive director at the Hereford Chamber. I used to do that too a long time ago, so I'm back.
So congratulations for
Thank
the,
you. There we go.
now we can see you and not just your hand.
It was, I can't get it on my computer, so I have to be on my phone. So I don't
Oh,
know what's
okay.
going on.
Oh,
So I have a little one today.
Okay. Well, it looks good. Now I can see your ceiling.
I know, it's crazy. I'm trying to get it. There we go.
Yeah. Gotta get one of those little stands for it.
Yeah, I know. That's what I need. But it's
I'm gonna
okay.
leave for a second. I'll be back.
So Donna was going to ask you, is there any way to do this the second Friday instead of the third Friday? Or is there something else on the second Friday?
I have my Fridays I keep open.
Yeah,
So
me too.
I'm-
But I
I'm-
have something the third Friday every other month. So
Okay. Well, that's something we can talk as, does anybody else have an issue? I don't know if we're required to have this date. Once
no, we
Kirsten,
can every
Well,
year we
Kirsten-
can pick what we want.
yeah, once Kirsten gets on, we'll
Yeah.
talk about it and see if that,
Yeah, I thought I could bring that up today. Might help me.
yeah, because it's good for, either is fine for me, so.
Yeah, I didn't know where the rest of the group was at with it.
Anybody else have issues in case we need to move it?
No, that would work for me.
Okay,
no, I don't think so.
okay. So make sure you bring that up, Doreen, when we, as soon as, we'll make that kind of the first order of business and
Oh, okay.
talk about
Thank
that.
you.
Get right away.
I see Jason.
I see Jason's office, but I don't, he left.
He's in the other office now, or he's in the other meeting room, because I
Yeah,
think
the other-
Kirsten's
the
gonna
other
be
Zoom.
there too.
The other Zoom room?
I think Kirsten is gonna be in that room. They must have been
Okay.
having trouble.
Okay.
Trouble morning.
No, we've done pretty well with the Zoom
I
so
know.
far. We haven't had
Yeah.
many issues.
Yeah,
This is the most problems we've had.
Yeah.
yeah.
So Doreen, are you gonna have to start wearing some really loud clothing now
Oh, God, I hope
to match
not.
your predecessor?
Yeah, no way.
He's
Mm-mm.
brought that garb to Washington County.
Yeah.
Oh, he has?
Speaker.
Oh,
Yes.
God. You guys
Not
can
every
have
day.
it. No, thank you. He's got enough of it still here.
That's probably what he's known for the most,
Yeah, exactly.
clothing.
Being crazy.
Mhm.
Yeah, he was the mayor when he was elected
Oh,
mayor
yeah.
when I was the chamber director last time.
Okay.
In fact, he opened a little business when I was first the director that I had to do a ribbon cutting at.
Oh,
And then he ran for mayor after that.
mhm. Okay. It looks like we're getting Ozark County Health Department on board.
Oh.
Well, we were. I don't know where they went to.
Don, can you hear us?
Yes, we
Yeah.
can hear you now.
All right.
Okay.
That was a 45-minute process. I'm sorry.
Not a problem. You know, we haven't had any, we've been pretty lucky not to have any issues with Zoom at all. I mean, realistically, everything's gone extremely smoothly all throughout the county. So Doreen has a question that she wants to bring up immediately. So
Sure.
Is there a way that we could have this meeting the second Friday of the month instead of the third?
I think that's up to the group to decide.
Okay.
it seems to be the consensus that it's not an issue for everybody. If anybody has an issue with it, please speak up. Like I said, I try to keep my Friday calendars open. This is usually the only thing I have on Fridays, if I can help it. So
Don, can we confirm that at the end of the meeting under next meeting date?
Sure.
Because I don't have a problem with it.
you have a problem with it?
I do not. That's
Okay.
Second Friday is fine.
Okay, we'll do it. We'll do it at the end of the meeting then. Okay.
Okay.
So
Thank
Kirsten,
you, everyone.
we muddled through without you, the call of order, affidavit of posting, and the minutes. So the next order of business will be the WIC program update.
Sure. So in your packet, you have. Oh, we need to know who moved and seconded
What's that?
for a minute.
Oh, I moved.
Okay.
Chris Dice moved.
Or you're gonna make a motion to change the date to the
No.
second.
No. On the minutes, she's talking about the minutes.
Yeah, we made, oh, yeah.
She wanted to know for.
Chris Dice
for-
made the motion and Lois made the second with one correction.
Perfect.
And can you explain the correction, Lois, so that they could have it in the notes? Sorry.
The correction was, it was listed as TB, was discussed, and it was actually LTBA, which they're in two different places on the report, and I just wanted to be sure that that was noted.
Are we good?
You've got it. Thank you.
Okay. All right. Okay, then moving on to the WIC program update.
So there was a document in your packet. I think what's most notable is our WIC numbers are increasing. So there are a number of families in our communities who have increased needs. I'm guessing from the pandemic and loss of work or reduced hours. But we have been able to meet those needs and plan to continue to market the program as much as we can.
Any questions from the board? Okay, hearing none, we'll move into the communicable disease update.
So you have the communicable disease reports in your packet. I just want to comment that if you look at diseases like influenza and pertussis, which we know are cyclical and happen, pertussis when kids are in school, influenza in the winter months, that both literally almost ceased entirely since last April. I think that's really because we are practicing strong mitigation measures against coronavirus, but as a result, it's also mitigating other viruses. So we have no flu influenza whatsoever, and I can't remember if we had any pertussis. I don't think we have any pertussis either in either county. So
There's
just
four.
interesting to note.
I have a request on this report.
Sure.
Would it be possible to, when we get this on our screens, like this one was 3 pages, could you make sure that the headings that are on the first page, where it lists the years and months and totals, continue on to the second and the third page? Because when I get to those pages, I always have to go back up to the first page to find out what column I'm looking at, because
We can
hard to
absolutely do
follow.
that.
Thank you.
I have to do the same thing, Chris.
Yep. Well, so it isn't just because I'm
No.
old then. Good.
Okay, good.
Yeah, we can add that. Thank you for bringing
Thank
that up.
you.
It's great.
Thanks.
And then I did ask if you could tell us what the difference is between LTBA and TB.
Sure. So I have Carolee Jacques, who's our communicable disease nurse here with us today, and she's going to speak to that.
Okay, TB is active illness tuberculosis. Okay, when you hear that, that's the one that people are most concerned about. LTBI is latent tuberculosis infection, meaning somewhere along the line over the years, you were either exposed to it and completely recovered from it, or you probably are receiving medication at this point because it's the first time you've been exposed. Again, infection you can control with medication. So in that respect, you're not infectious. You can't pass it to anybody if you have latent TB.
Okay, thank you very much.
You're welcome.
Okay, are there any other questions regarding the communicable disease update? Okay, we'll move up then. The COVID-19 update, burden, contact tracing, testing, and vaccination.
Sure. So lots to talk about around COVID-19. Our numbers have decreased significantly since November. However, we're back in an upward trajectory over the last few weeks, but I could speak to just the daily number of cases we're getting. We have capacity with our contact tracers to do almost 300 cases a day. And I think yesterday in the morning, we started with 60. So we're well positioned for another surge, but our numbers are significantly lower. It just as it is. We don't know necessarily if that is a symptom or if that's indicative of less testing. The question I have around it is our hospital systems are still seeing quite a bit of, our hospitals are full. And that is very telling that the virus is still circulating in our community, but our overall total numbers are lower than they've been. Another interesting piece of note, and this is relative to Ozaukee County, but they've been doing a wastewater treatment research, trying to identify, looking at wastewater to see what the prevalence is in the wastewater at various wastewater treatment centers across the state, and Cedarburg is being added on Monday. So that will be an interesting data point for us to look at if our numbers in Cedarburg in the wastewater align with the numbers of positive cases we have in Cedarburg. So that will be online at DHS on Monday. Any questions about just our overall numbers?
Yeah, are we, for community spread, are we still looking or expecting that 40% or so more that's out in the community that it actually has been tested, or what kind of numbers are we looking at that are the positives, but the unknown positives and the asymptomatics that have never been added to the numbers?
Yes, so we know that people who are asymptomatic can spread it. There was an article in the journal, in JAMA, the Journal of American Medical Association. I want to say it was last week. And I'm sorry, I can't remember, but around 50% of cases are transmitted by people who are asymptomatic. So we know that's occurring in our county, in our counties, which is why it's so critical to continue to wear masks and social
Right.
distance.
Yeah, I guess the question I have is, it's one of the reasons why we should still continue to mitigation efforts is because there are unknown infections
For sure.
within the community.
Many.
So I'm just kind of wondering if we have any kind of idea of what that number would look like, other than conjecture.
No, I think we can take averages from the rest of the country. And I think the average is around 40% of cases are asymptomatic. And we can make that assumption that we can apply that to our counties.
Okay.
Kirsten, what
This
is
is
going on with the testing? Are we still doing that at the fairgrounds in Ozaki?
We are. So we have curative testing available Monday through Friday in both Washington and Ozaki County at the Ozaki County Fairgrounds and Washington County Fair Park. And so 5 days a week. And then we also have testing available for children, school-aged children here in Ozaki County, Monday, Wednesday, and Friday. So parents of kids who are in school who are either exposed or symptomatic and they can't get in through their pediatrician can call us and we can test them as well. And that's a pretty quick turnaround, about 24 hours, to make sure that we can mitigate and stop the spread in schools as quickly as possible.
Kirsten, are we doing any screening for that a more infectious variant that they're finding throughout the country?
Yes. So our contact tracers are identifying cases. There's a list of criteria. It's people who've traveled, if they've been reinfected. I can't remember. There's like 5 or 6 criteria off the top of my head. I can't remember them all, but there's 5 or 6 criteria that our contact tracers know of. So if anyone fits one of those, we send the information on that disease investigation to the state, and they look for the samples so they can do a sequence on it and identify if it's potentially that one of the new variants.
Okay, thank you.
Can you give us some information on vaccination?
Sure. So that's my next.
Okay.
The next
Getting
goal.
lots of questions on that.
I'm sure you are. So we are in the midst of doing 1A. So 1A is healthcare workers broadly, EMS, and then fire and police. So law enforcement was added last week to be eligible. We have completed EMS in Washington, Ozaki County. I believe all of our police and fire are either registered to get vaccine or have received it already. We've done that through a partnership with our healthcare partners. In particular, Aurora has been a tremendous partner. They assisted with our EMS vaccine efforts as well. Really, they've helped run it. And then in-house, we are doing vaccine clinics every week. We get 500 doses this week that we will be through by the end of today. And that's for that 1A category as well. So anyone who's a dentist, anyone who's really an unaffiliated healthcare worker, so they don't work for a healthcare system. So we've got dentists, chiropractors, behavioral health, speech therapists, occupational therapists. We identified about 4,000 people in that category in our counties. We've done, like I said, we'll have finished 500 at the end of today. And we have also been working really closely with Freighter, Ascension, and Aurora and sending them lists of names and emails to make sure that we get through those people. We are hopeful that we will be through the first dose for that entire population by the end of next week.
How many people are taking the vaccine? Is it all of them, or is it, what's the percentage?
I think we're seeing about probably 30 to 40% of those people in that 1A category who are not taking it. It's hard to know because we're sending out surveys, and if they don't respond, we're not capturing them.
Mm-hmm.
Some of the questions I've been getting is like, what is going to be the role of public health? Are we going to be doing the majority of the vaccinating? And are we going to have a drive-up vaccination?
Sure, I can speak to both those things. So the 1B category, initially we were told that it would begin at the end of January. I anticipate that's going to open up sooner. So 1B includes educators. Currently, the state recommendation that's being reviewed right now is 70 and older, and then individuals from the essential workforce, which is pretty broad. Again, we anticipate that's going to open up sooner. The state gave health departments guidance this last week that we are responsible for just shy of, I want to say it was 15% of total vaccinations would be physically done by the health department. The rest are being done by our healthcare partners and pharmacies. And we are seeing that play out now with 1A, how we're serving really in a role of assurance. So we're facilitating, connecting people in 1A to either a pharmacy or a healthcare provider that can get them the vaccine, or they can register through us as well. So we're also encouraging people that take whatever avenue to get a vaccine that you can. There are going to be many opportunities. Take whichever one you can get first. So, there's a little bit of confusion right now because people are saying, I got an email from Aurora, but I also got an email from the health department. I don't know which one to do. And we're just saying, pick one, and the faster you can get it, the better. We just want to get shots in arms at the end of the day. Drive-through is a bit challenging. Dr. Zills, as our medical advisor, we've been meeting almost daily, talking about the various options and how the vaccine rollout is going. The challenge of drive-through is everyone who gets vaccinated needs to be observed for 30 minutes. I personally, and I know Dr. Zills feels the same way, am not comfortable having people sit in their car, and if they go into anaphylactic shock, we have no real way of knowing. In theory, they could, honk their horn, but what if they can't? It's very difficult to have eyes on people who are in cars. The other piece that is difficult is it's cold. So we're seeing it done in Florida, in California. I mean, they're in different climates. That's not to say it's impossible. I just think we have additional challenges here in January. Our plan for 1B, again, is to serve in that assurance role. We have started a listserv on our website. So if you have constituents who reach out to you, if they go to our website, they can see if they're part of category 1B or 1C. They just click on it. It says forms. They can click on it and register. To be added to a list. So once we do have information and we have doses, we can make sure that we start to get those in arms. Our role in 1B, again, I think our primary focus to start is going to be educators. We are tentatively scheduling 2 mass clinics. Another challenge is we don't know from DHS how many doses we're going to get from week to week. So we order them on a Tuesday and we find out on Friday or Saturday how many doses we get for the following week. And there's no guarantee. So for example, last week we ordered 600 and we got 500. This week we ordered 800. We still don't know yet how many doses we're going to get. It's difficult if we want to plan a mass vaccination clinic and say order 5,000 doses, and then they come back and tell us they have 500. It's very difficult to do the planning and setting up sort of the infrastructure and the volunteers and the staff to do something large scale when we aren't sure how much vaccine we're going to get. So we're working through those. We're trying to be creative and able to pivot and scale up as quickly as possible. But it's definitely, we have some barriers around process and just in terms of how vaccines flowing into communities.
With the staffing, I'm wondering now, are we going to be using the EMTs in the community, or are we looking at like nursing students from Concordia? Are we looking at retired nurses? I mean, there's a lot of people that might be able to help.
Yep, we are looking at all those populations. We're currently partnering with Concordia pharmacy students. They're working our clinics now. I know if Dr. Zills wants to comment on EMS, but our plan, we're meeting on Monday to think very critically about the mass vaccination clinics and how we're going to scale them up and who potentially would be available. And I know EMS is one of them, and retired nurses. We do get calls from people who want to volunteer, and we're encouraging them to go to Weaver. It's WEAVR to register as a volunteer, so they can get called up at any point. But it's a great website for us to be able to tap into, so it's somewhat coordinated.
Is there any planning for the homebound, the elderly that don't live in assisted living but are homebound?
Yeah, we've been talking a lot about gaps in that sort of health equity piece. How do we get to people who can't get to us? We do have plans. We're talking about how do we get to them. The other piece is our pharmacies have been matched with all the long-term care. So Walgreens and CVS have been matched to long-term care. There is discussion that pharmacies would also take some responsibility for those people, but we are talking internally. We provide services to some of those people for other things. And then partnering with the ADRC and Human Services as well but absolutely.
I have one more question. I just, people have been asking, like those who are not on 1A or 1B, when will they find out when they're eligible to get it and where should they go?
That's a good question. I think our hope is, again, I said the state has said to health departments that you are physically responsible for providing about 15%, which for us is 18,000 doses between the two counties. And the goal for us between both counties to get to 75%, which is herd immunity, is around 170,000 doses. There's no way the health department could do that. Our hope is as we progress, is that people can go to their healthcare provider. So healthcare systems, people who have a primary care doctor will be able to access the vaccine through their provider. And then we will fill the gaps. So those individuals who don't have a medical home, people who potentially are uninsured, people who are homebound, unable to get somewhere, to get to another location. So that's kind of how we're thinking about it. But again, it's unknown yet what everyone's roles are. For public health, it's clear to us that the expectation is almost 20,000 doses and that we're serving an assurance role to make sure people get connected.
Oh, Kirsten, it sounds like communication with DHS, state DHS is still lacking, and cooperation is still kind of, I mean, does the state yet have a plan to, I mean, the last that I read, there were still 100,000 plus doses that the state was pretty much sitting on. So any progress that we're making? I mean, we're doing on our end, we're doing what we need to do on our end, but we need the cooperation from the DHS to make sure there's a seamless transition from getting the doses and being able to, we're able to deliver them. We're just not getting what we need.
I can say I think DHS is also in a difficult position because they don't know from the federal, so the allocation comes from the federal government and then down to DHS and then down to us. So in this case, I think they don't necessarily know what the allocation for the state is. They find out week by week as well. So this is sort of a systemic issue that is above it, is happening at the national level.
Mm-hmm.
It's been challenging to plan, like I said, without knowing what DHS's plan is, and that has not been entirely forthcoming. And again, I think that's a symptom of the whole system. There's a lot of unknowns, but we are prepared to take as much vaccine as we can get and get it into arms as quickly as we can.
Mm-hmm.
I can tell you too that between the two counties, since vaccine was available, 5,600 residents have been vaccinated.
Okay.
I have a question. We're hearing reports in the news that the state has not released about half of the vaccinations that they have. And do you know any reason why that would be? I mean, is it because they're piecemealing it out, or why wouldn't they get as much out as soon as possible?
So I don't know. I know, for example, that we get Moderna. So Moderna, which is the vaccine brand that we are distributing, we get it directly from the manufacturer every week. So the state isn't physically holding those. They're coming directly from the manufacturer. Pfizer is different because it has to be held in cold storage. So it's being held in hubs. And that piece I don't know much about because it's controlled by the state and by health systems primarily. So I can't speak to that at all.
He's in here.
You get him? He's whining.
I heard him whining. That's what I want.
And this is Steve Zills. I would say in the last couple of weeks, I'm a bit pleasantly surprised at how fast we've moved through the 1A providers. It seemed like it took us a little while it did take us a little while to get the gears spun up. But as Kirsten said, hopefully, I can't remember, Kirsten, did you say by the end of next week, you think that all the 1A providers may be taken care of between public health and the health systems? That all has happened extremely quickly here just in the last week. So I'm cautiously optimistic that the gears are spinning up and that we'll see some better progress here moving forward.
Is that with the second dose too, or is that just the first dose?
They'll take care of the second doses as well. So they obviously haven't received the second doses because they have to wait either 3 or 4 weeks. But wherever the person gets their first dose, it's already kind of pre-programmed, if you will, to get the second dose through that same provider, whoever that is.
But at the end of next week, all of 1A, we anticipate, all of 1A in our 2 counties will have gotten their first dose, and some the second, but all of them at least the first.
Any other further questions or any other information, Kirsten, from that you need to?
I have a question. I get my question is, how would you address those that have decided not to take the vaccine? I'm not sure what the downfall is or what the problem would be if you do take it. What are the side effects that you could get from that vaccination?
Dr. Zills, you want to speak to that?
Yeah, sure. So, I think the main concern that I'm hearing most people have is that we just don't have the long-term studies to demonstrate the safety of this vaccine. We've had certain vaccines like tetanus and MMR and things that we've had for decades. And so I think that makes people feel a little more reassured that we have that long-term data safety. Of course, there's always going to be those people, the anti-vaxxers that believe what they read on Facebook and other sources, which just is incorrect medical information. But I think in this case, the majority of the people that are declining it are just concerned because there's not the long-term safety data. I will say that a week ago, I put together a video for one of our fire departments, and afterwards, I had several people contact me and said that they had initially not planned on receiving the vaccine. And after listening to kind of my explanation of how the vaccine is made and things like that, that they changed their minds and they were much more comfortable getting the vaccine. So I think a lot of this has to do with education. And, Kirsten, that might be something that we haven't really talked about, but, there's really a lot of great education that's already done out there. And I'm wondering if we should try and find something that describes the vaccine and describes how it was made and things like that, and maybe post that on the webpage and try and make that more publicly available. Because in my experience, once people get a good explanation from a reputable source, at least a proportion of them get more comfortable to receive the vaccine.
And
I think
we did put together a 3-page document on Moderna, sort of an FAQ and why it's important to vaccinate. Dr. Zills, I'm 90% certain it's on our website, but we also sent it to all of our school districts in anticipation of 1B. They wanted something for their staff. So we can, I'll make sure it's public, but we've also been pulling from, for example, the De Beaumont Foundation. There are other national organizations that are putting information out around vaccine hesitancy. And we're trying to take some of that and put it up on our social media and share it as widely as we can.
Okay, good. Because I did talk to someone yesterday, and that was her concern was, I researched this on the internet, and I don't think it's a good thing, and blah blah blah. And she's just one, and I'm sure there's a lot of others who have done the same thing and may not want that vaccine based on information that they're getting that may not be accurate at all. That's my fear.
Right. I think what people don't realize is even some of these vaccines that we've had for years and years, there are a minimal amount of side effects that people get from them. It's the nature of the beast, the way your genetic profile is and how you respond to things. And some people, but it's such a small risk opposed to the risk of especially if you're a high risk to this disease, it's not even, it really shouldn't even be a consideration anymore. So, Okay, are there any other questions? Okay, let's move on up to department update.
So this is really about the news that came out yesterday about me being appointed by Mayor Barrett to be the health commissioner or the commissioner of health for the city of Milwaukee.
Saw that on TV last night. It was a very nice
I don't
photo.
listen to the news.
So I just wanted to say that it has been an absolute pleasure and honor to serve the people of Washington, Ozaukee County.
For us
But-
as well.
Thank you.
Mhm.
We are working through with leadership from both counties and HR, the process of hiring someone into the position. There will be an interim or two potential interim individuals appointed who are both fantastic and I think will serve us well and continue to move us forward. We have plans in place, like I mentioned, around mass vaccination. I really feel that our health department's in a great place in terms of being able to respond through the rest of the pandemic and into the future. So I have an incredible staff here. I couldn't be prouder of the work we've done in the past 10 months, truly. So I think we're in a really great place.
Mhm.
Well, I just want to say we're going to miss you. I think you've done a fantastic job. And I wish you luck in what you're next endeavor.
From,
We want to say too much.
I said it's from going from the frying pan into the fire. So, but yeah, I'm glad, you know, we knew you're going to be moving up because you're a very special person.
Yeah.
The amount of work you put in and the value that you bring has been much appreciated during your time here. And moving forward, so this is going to be really the first time that we're going to be hiring a director. When we did the merger, it was Kirsten was already hired for Washington through Ozaukee County. So I want to have the Board of Health to have a role in the hiring process. So how that fleshes out, we'll see in the future. But I really want us to have place our imprint upon the new replacement for our health director. It's going to be big shoes to fill, but we'll work together to make sure it happens.
And I agree wholeheartedly. And you know, I want to be able to assist in any way I can. I know there are or at least one person from our community who is fantastic, who is potentially interested, which would be great. But I also think it's critical to have representation from the community and from the Board of Health and from the county boards in the interview process. Just similar to what I went through with the city of Milwaukee, I just think it's really important to have support from the people that you're going to be working for. So absolutely, Don, I agree.
I do too.
Mm-hmm.
Well said.
Well, anyhow, I appreciate
Thank you.
what we do at the county board. You know, it's like standing ovation kind of thing. So,
Thank you.
And you will be missed.
Thank you.
Yeah, thanks for all you've done.
Thank you. It's just been a pleasure. And I've learned so much from all of you too. So I can't say enough great things about my experience. It's been a little bit rough the last 10 months, but we're in a great place.
Yeah. Well, I can imagine in being in Milwaukee, there's a.
It might be a
You're
little
gonna
more
have
rough.
to get them in line.
Yeah.
And now you have to get them in line. So good luck.
Thank you.
Yep. Okay.
Well, at least the mayor was smart enough to see the talent that we've had here in Ozaukee and Washington County. So that's to his credit.
Thank you.
Okay. The next meeting date, we're looking at the second Friday of the month. And are we going to be meeting again? We're usually every other month, correct? We're not.
Correct. It's every other month, and we can send out an updated list of dates.
Yeah, it would be March 12th.
Yep.
March 12th.
Yeah.
Okay. Hopefully, maybe by March 12th or at least maybe the next meeting after that, we can actually do in-person meetings. Wouldn't that be nice?
Wouldn't that be a hoot?
I think March might be a stretch.
Yeah,
Yeah.
yeah.
May
That
might even
means-
be a little bit of a.
The May one may be pretty realistic, so.
That means I have to dress my bottom half and not just my top half.
Chris, we don't need to
Oh,
know
we
that.
saw that you were dressed because you got up and walked away, so.
Oh, that's right.
Otherwise,
much
there would have been
information.
comments. Okay, if there's no other business, we've completed our agenda. We're hereby adjourned. Thanks everybody for coming, and again, welcome Doug.
Thank
Yes,
you.
welcome.
Yes.
Great. Everybody have a great day.
You too.
Have a
Bye-bye.
good
Thank you,
day.
you too. Bye.